care that can make a big difference. We'll start by talking about how positive reinforcement can help kids feel more at ease and confident during their visits. And then we'll highlight some of the common practices in pediatric dentistry, from preventive care to treating common issues. We'll also share some tips for communicating effectively with neurodivergent and medically complex children, making sure that we meet their individual needs as well. Finally, we'll discuss why it's so important to create an inclusive, supportive environment where every child feels comfortable and valued. So welcome to our office. We're excited to give you a glimpse of what makes our practice special and how we create a truly magical and personalized experience for each of our patients. We are a 2-doctor, female-owned private practice, and our team is like family. We work so well together and have a lot of fun in the process. Here's our Christmas card this year. It was such a blast putting it together. Our main goal is to make every child's visit a positive, memorial one. And we hope that by sharing some of what we do, you can take away ideas that will help make your pediatric visits just as smooth and enjoyable. So there's several ways that we can create a positive dental experience for the kiddos. First, create a child-friendly environment. So a welcoming space filled with toys, bright colors, and entertainment can make a huge difference. Friendly front office staff who greet children with enthusiasm and warmth that set the positive tone right from the start. Tell, show, do. This is a technique that's incredibly effective in helping kids understand what's happening during their appointment. So we explain each step, show the tools or equipment, and then perform the procedure, helping the child feel more at ease. And this approach is especially helpful for first visits, allowing the child to warm up to the setting. Praise and rewards. This is the best part of the dentist. Celebrating every success, big or small, helps children feel accomplished. So prizes, special awards for completing treatment or stopping habits like thumb sucking. And also fun activities like clapping or a tunnel. We'll show you guys a video of that later. Can make the experience more enjoyable and rewarding. Positive language. So using comforting and friendly language is key. Instead of scary terms like pain or needle, trying to use words like tickle toothbrush or nummy jelly or blowing a bubble. Additionally, it's important to redirect parents from bringing their own dental anxieties into the room and guide them towards solutions while acknowledging their concerns. Keeping visits short and sweet. Kids have a shorter attention span, so keeping appointments around 30 minutes helps prevent them from feeling overwhelmed. By scheduling efficiently, you can minimize wait times and ensure kids spend as little time as possible in the chair. And then staying calm and positive. Children can pick on the energy around them, so maintaining a calm, upbeat attitude is essential. By giving clear instructions, showing empathy, and staying confident, kids can feel more secure. The more relaxed you are, the more relaxed they will be. So I'm going to walk you through a first visit for babies. It's such an important milestone, and we see a lot of little ones in our practice. So we'll start by gauging the parent's comfort level at first, as first-time parents tend to be a little bit more hesitant, while those with more experience are usually more at ease with the process. But step by step, we start with a first visit photo. To make the visit more memorable, we take it with a Polaroid camera, and this keepsake is a fun way for parents to remember the visit. Sometimes the child is smiling, but more often they're making an adorable worried face or even crying, which are truly priceless moments to capture. And then we warm them up with a toy and play. So we use toys, rubber duckies, pinwheels, or even bubbles to engage with the child. The idea is to show them that we're here to be their friend, not do anything scary. This playful interaction helps the child feel more comfortable and also start building trust. I like to engage with the child, but also answer any of the parents' questions right off the bat. Just because after, you brush their teeth and everything, they're a little bit upset. So the parent might need that time to comfort them. It's not until about 3 to 4 when children start feeling comfortable enough to lay in the chair and go through the full dental appointment. Tell, show, do. So if the child seems receptive, we use the tell, show, do technique, explaining what we're doing, showing the child the tools, and then performing. We might start with the mirror, the polisher, and the suction. It's a great way to ease the child into the experience. And then positioning for comfort. So depending on the child's age and the parent's comfort level, we'll explain these 2 techniques, knee to knee, or having the child sit on the parent's lap if they're not able to sit in the chair independently. This makes the experience more comfortable and less intimidating. Now it's time to brush their teeth. So we find that singing a fun song while brushing with the parent, holding child's hands, helps makes the process smoother. If the child allows more work, like polishing, scaling, or using water and suction, we'll proceed. But if the child becomes upset, we stick to brushing, and we may scale or floss if the parents are comfortable with that. And then we finish it up with a fluoride treatment. Lots of praise and rewards. Positive reinforcement is always key. We make sure to praise and clap for every little success. Stickers are a fun reward and help create a positive association with dental visits. And then it's playtime. We let them go to the waiting room, or we have a little cubby area to hang out, watch the movie, get some of their wiggles out while they are waiting for the dentist. And then the dental exam, we keep the positive energy going with more praise and encouragement. Sometimes a little singing helps too. The best part of the visit, according to most of the kids, is the prize. This leaves the visit on a high note, and it's something that they'll likely remember. For babies, we offer age-appropriate toys like rubber duckies or bubbles, ensuring they're safe and fun. Follow-up. After the visit, we send a thoughtful card to the parents, thanking them for bringing their little one in and letting them know we look forward to helping them care for their teeth for years to come.
So a few topics we might talk about at that early childhood visit is fluoride. In Portland, as you all know, it's a little controversial. So we like to kind of just keep it short and simple, and obviously answer any questions parents might have. So just a smear of toothpaste on the toothbrush until they're able to spit that toothpaste out. It's never that huge gob you see on TV. They're just trying to sell you toothpaste. I do like to recommend the xylitol toothpaste for our non-fluoride families, just as an ulterior, another option, so that they don't feel like we're pushing fluoride on them. Systemic fluoride is another something that we can offer as well. We typically will make that more of an option to families that have like a high caries risk, where we're noticing like we're not doing the best with our home care. And genetics, as you know, can play a big factor in our teeth. So if we know XYZ, that's something that we'll recommend to the patient. I'm gonna head, oh, why are the titles not on there?
Oh.
Okay, there we go. I'm gonna head down to the home care section. So having help brushing twice a day and flossing any teeth that touch together. So that's always usually a relief for parents, that they don't have to floss right away. Having them play with them, get used to them, that type of thing. Before those second set of baby molars come in, typically is what we're recommending, just so that we're not adding a ton of stress onto the parents with this like newborn child, and then now they have to floss all the teeth. That tends to stress them out, and we don't want to do that. Main take home there, we just want to make sure that they know that we want them to help until age 8 with the brushing, just because dexterity takes a while to develop, and you want to make sure you're getting all those areas nice and clean. Diet for little cutie pies. Nursing's usually a big topic that we talk about. Sugar is sugar, even though it's amazing, magical gold liquid. We don't want it sitting on the teeth all night. So if they're still nursing in the middle of the night, we have these little finger swabs that we can give them to do a swipe. There's also those great little xylitol wipes. I used to keep those by the nightstand and just do a little swipe, just to make sure that sugar is not sitting on the teeth all night, because they don't swallow that last swallow. And the point is to get them to bed. You don't want to wake them up to brush their teeth, right? So that's a really good alternative to sticking a toothbrush in their mouth. Oh, a little tip for the flossers. If we're practicing with the flossing, kids don't typically go through them like we would, I would use a flosser and it'd be destroyed by the time I was done with my mouth. Whereas they don't have very many teeth that are in contact. So I do tell parents, if you're comfortable with it, rinse it off, use it again. That's totally fine. We're saving the planet little by little again, but I make sure it's clear. If you're not comfortable, just use a new one every time. We're going to talk a little bit more about habits on the next slide as well, but bruxism, that grinding, is really, really common in kids. I feel like that's one of the #1 questions I get from parents. Like, it sounds horrific. Is that okay? About 20 to 30% of kids grind their teeth. And typically about a third, or only a third of them will continue that into adulthood. So they typically grow out of it, and we don't usually do any intervention when they're kids and they're grinding. If it continues to adulthood, that's when we'll talk about like night guard and necessary intervention there. Another thing I just wanted to like side note here, any snoring concerns or sleep apnea might be like a tonsil and adenoid situation, in which case we would involve an ENT in a consultation for that. Okie-dokie. Oh, another, hang on. Let's do some more clicking here. Okay, a little bit more. So this one's all about thumb sucking, and just a little bit more in depth with pacifier as well. So I like to start on the pacifier side because the pacifier is typically used earlier on in age, and is something that can be removed. It's not physically attached to the child. So always easier to break a pacifier habit than a thumb habit. We recommend stopping for the age of 2 to 3, depending on who you're talking to, because a lot of the times that bite will auto-correct itself. And what I mean by that is typically a pacifier mouth, you see the flaring of the anteriors, the palate is more vaulted and narrow, and we obviously don't want that. We want the palate to be wider, so it allows more room for the teeth to erupt naturally. We have time at the end. I have a funny pacifier story, but we'll see if we have time at the end. Again, the thumb's harder to take away. Oh, I will say, if you're trying to stop a pacifier habit and they start sucking their thumb, give them back the pacifier, because again, harder to break the thumb habit. Pacifier is easier to break than thumb. Sorry. We've had success with patients breaking their thumb habit when it's not mom or dad that's like motivating them to break that habit. It works best if it's like a cool aunt that they like to hang out with, or like the nanny, or grandma, grandpa, like somebody else externally that's in the family, but it's not mom or dad. As you know, our kids are best with their teachers and other people, rather than the parent that they're super, super comfortable with. Another thing for the thumb that's really important is a patient has got to be on board. It has to be their idea. They got to be involved with it. Otherwise, you typically won't see success with that cessation of the thumb habit. There's lots of things. There's the icky, tasty nail polish. There's this T-guard we have a picture of. I actually just heard a story of a patient this week ripping that off. It has not worked. The thumb will find a way. So there is that fixed appliance that ortho can place to stop the thumb from getting in there as well. But overall, just a really hard habit to break. So good luck with that one. Oh, and treasure box prizes for those habits, because they are harder to break. So a little bit bigger of a prize is also another external motivator, or a fun date with, cool auntie or nanny, whoever helps break the habit. All right, x-rays. So typically at our office, we'll take about 3 panels in our patient's lifetime, one between the ages of 6 to 7, to just, again, look for alignment, make sure all the teeth are there, one again at the age of like 11 or 12, and that's only if they are not under the care of an orthodontist currently. And then one again around the age of 16 to 17 to look for wisdom teeth. These are so, so important, and I can't stress it enough because we have seen teeth look totally fine with a pano at age 7, and then they just decide to go rogue. So teeth can definitely shift course, so very important to stay on top of those panoramic images. The bite wings, we like to take them once a year, but we will do every 6 months if we have a high caries risk patient. So either they have active caries that we just maybe can't quite treat yet because the behavioral side of things isn't quite there, or we have lesions that we've treated with SDF, which is silver diamine fluoride, and we want to monitor how that SDF is working to arrest that lesion. We like to start them as early as possible. So age 4, 4.5 would be like amazing, because we can, again, treat things less invasively if we can catch it earlier. Again, we really take cues from the patient. We're gauging their readiness to be cooperative, to be able to bite down all the way. Can they be frozen? Are they able to sit by themselves? Are we going to push a 4-year-old to do bite wings? Maybe if the home care was really, really poor this time and, you know, they're not really cooperative with things at home, like maybe we'll try a little harder and spend a little extra time trying to get those bite wings, especially if that floss is snagging and we are suspicious that something's going on. And then always document, document, document. If you're not able to get those bite wings, make sure there is a very good explanation as to why. Occlusals, just a little fun fact, about 20% of the population is missing teeth. So that's always a fun reason to take those ones. Those are some of my favorite radiographs. Sometimes parents want to stretch out radiographs. That's a conversation between the dentist and the parent. And we do that recommendation based on the patient's needs. Again, if they have lots of interproximal lesions, we're going to want to take those radiographs more frequently. Whereas if they have great home care and no lesions we're watching, we're going to be able to stretch that out a little bit more. Orthodontic patients, we don't typically take x-rays just because the wire goes right through where we need to see, not me, the doctor. And then with an RPE, again, sometimes if we have teeth that we're watching, we'll try to get it. And then sometimes we'll wait till that RPE is out, which is the rapid palatal expander, because it kind of gets in the way of the sensor. Some parents are very concerned with the amount of radiation their child is receiving. I like to say it's about 30 minutes in the sunshine just to take those bite wing x-rays. And we have the digital, which is 80 to 90% lower radiation comparatively. So it's like you get more radiation from eating a banana. So they're safe. Sorry, this is a lot of information really quick, you guys. I timed myself and I was 15 minutes over. So I'm just like spouting this stuff off for you. What I do when there's a patient and it's like very first time x-rays, we're either trying occlusals or we're trying the bite wing pictures. I'll sit them in the chair and I'll show them everything, you know, like this is my camera. It doesn't do a flashy, makes a little Tweety bird sound. I'll take the camera and physically place it like on my nose. If we're going to take an occlusal, I'll place it on my cheek to show them like that there's no fear that this camera is going to hurt you. There can be a lot of fun challenges with x-rays. Patients who have a strong gag reflex, we have a couple of different techniques that seem to work really well for us. Salt is one of them. We call it popcorn salt, French fry salt. It works wonders. Take a little spit off their tongue, you dab a little bit on your glove, have everything ready to go, like the camera is right positioned where you need to have the picture taken. You swipe, have them swallow, open big, rest, and then you're good to go. Distracts the tongue and it really works really well. A magnet sticker is the newer things that we've come to dabble with, I would say. I've seen some really good success with it. It kind of, it is in a sense replaces acupuncture. There are medians in our mental labial fold there of our chin that triggers a gag reflex for some reason. So these magnets are kin friendly because we're not about to stick an endophile, which is a sharp, pointy needle essentially in that place for that gag reflex to be suppressed. So the magnets, again, I don't know if it's more of just a placebo effect, but when I tell them that this helps make it easier and they get to take the picture and then they have so much success with it, I'm like, see, you did it. Great. Another few techniques: humming, lifting your legs straight out like an L shape, pretending the floor is lava. Don't let your legs fall because the floor is lava. And then holding your breath. That's more for older kids who understand the idea of holding your breath and not like that it's not going to be forever. And then praise, praise, praise. I jump up and down. I high five. I, just like make it the world's biggest deal when we're able to get those pictures. Okay. Again, this isn't really my area of expertise. I'm not diagnosing that they need to be seen by orthodontics. But these are just two really big indicators. So if a kid has a crossbite, meaning the maxillary teeth are coming inside of the mandibular teeth, that should be an automatic referral. And then severe crowding. Sorry for all the door closing, you guys. So teeth are in there like smushed in there like best friends, like flared, lingual, facial, all the situations. That's an automatic, okay, we need to go talk to some fun people about how to get these teeth go in the way that they do. You typically will see a lot of kids ages 6 to 11 doing orthodontic treatment just because that's the highest percentage of growth of the jaw happening at that age. So that we're just trying to take advantage of those flexible bone sutures at that point to make it easier for them. We do recommend picking an orthodontist near the patient just because they do have frequent visits with the orthodontist, and just pick somebody that you have a great vibe with. Go to several different ones. Maybe this location has like cookies afterwards and this location has, it can be whatever. As long as your kid is happy and we're engaged in the treatment plan, that's where you need to be. We see older kids at our office, teenagers and young adults, college age kids are still seen in our office. So we have, a few rules of when we need to kind of boot them out, which I'm not gonna lie to you, a lot of them are super sad when we say you can't come here anymore. Because we do offer fun things like flavors of fluoride to pick from and prizes, like gum and chapstick and keychains. But then we have the other side of the coin where there's a teenager that walks in and there's a 2-year-old sitting next to him and he's like looking at like, his life is going to end, if he comes here a minute longer. So we always say you're welcome to come here as long as we're not having adult issues. And by adult issues, I mean like perio issues involving like recession areas and deeper pocketing, extensive cavities on the permanent teeth. So I mean like huge to where maybe possibly a root canal would be involved. And then multiple cavities on permanent teeth. So we've seen people get orthodontia off and have cavities between every single surface. Like that's an issue. That's a case better suited to take care of by a general dentist, just because they do teeth like that all the time. And we usually work on baby teeth. Oh, I want to touch really quick on soda and just tips for drinking it. We obviously don't recommend soda, but a lot of our teens do drink it. So we recommend using a straw. If you're going to drink it all the way down. Like don't linger on it for an hour, and then try to rinse with water after consuming the soda. Basically same thing with sports drink. The lowest the sugar, the best. So not like the high sugar Gatorade or anything like that. Either the low sugar, the no added sugar, and then rinse with water afterwards.
All right. So in pediatric dentistry, we often encounter different challenges that can make the experience difficult for both the child and us. However, with the right strategies, we overcome these obstacles and we help ensure that every child feels comfortable and safe during the visit. That is the most important thing. So here are some of the common challenges and how we can address them. So high dental anxiety. Many children experience dental anxiety, which can make the visit for us and them overwhelming. One way to combat this is through gradual desensitization. So this means slowly introducing the child to the dental setting through happy visits where the focus is on positive interactions, such as simple greetings and showing them the office in a non-threatening way. Offering choices and giving the child some control over their experience can also reduce their anxiety. Simple decisions like choosing the flavor of toothpaste or the color of their gloves can make a big difference. For some children, having a parent present in the room can provide comfort and reassurance. And incorporating breathing exercises and using textured weighted blankets or a private room can help calm the child. Wiggles and hyperactivity. Some children have a lot of energy and it can be difficult for them to sit still for their appointment. For these kids, offering a fidget toy or encouraging them to sit on their hands can provide a healthy outlet for them. Movies or other engaging distractions can help their attention focus and help them remain calm. It's also important to actively engage with the child during the appointment, whether it's talking to them, making them laugh, or involving them in the process. Staying engaged can help them feel more relaxed and in control. We love these nervous noodles or squishy balls for the children to hold. And then language barriers, communicating with the children who speak different languages or who may not fully understand what's happening can present its own set of challenges. To overcome this, visual aids are invaluable. Showing pictures or using hand gestures can help children understand what will happen during their appointment. Using simple and clear language is key. Avoid medical jargon and focus on words and phrases that they can easily comprehend. And then if you have to, translation apps can be helpful. Gag reflexes. Some children have a sensitive gag reflex, which can make certain procedures like cleanings or x-rays more challenging. To minimize the discomfort, we try positioning the child in semi-supine position, where they're slightly upright instead of just fully lying down. This can help reduce the urge to gag. And then constant suction is also helpful in keeping the mouth dry and reducing the sensation that triggers the gag reflex. Breathing techniques like having the child breathe through their nose can help them stay relaxed. Some children respond well to the use of salt, like Kayla mentioned. And then also there's nitrous oxide. We can use that as well. And then just being mindful of textures and tastes. It's important. Limiting strong flavors and rough textures can reduce the chance of triggering the gag reflex. And then, so for these children, we can start by using regular toothpaste and Nada. Nada is a brand, it's no added flavors or scents to help reduce sensory overload. If fluoride treatment is recommended, offering fluoride gel instead of varnish can often feel less intrusive. When it comes to polishing, doing like a full mouth polish rather than going arch by arch can help reduce the number of times the child needs to experience the pause and rinse. It can also help to encourage the child to stay open and avoid tasting things that they might not like. After the appointment, giving them a lollipop or other xylitol sweetened treat can help reset their taste buds. For children who have a strong preference for their own routine, allowing them to bring their own toothpaste and toothbrush from home can help them feel more comfortable. And then sealants. Applying sealants can be tricky, especially with the kiddos. One technique that can make this easier is using four-handed dentistry, where an extra set of hands is used to help maintain the child's position and ensure efficiency. Tools like Dry Shield or Isolate are also often helpful in keeping the area dry. Sometimes reverting to the old school technique of working one tooth at a time can be more effective for the younger ones. Also, I actually just learned this from Dr. Sheena. Shifting the child's jaw to one side can help improve the access to the difficult to reach areas like the second molars, making it easier to apply the sealants without too much pushing and tugging. And then our favorite helicopter parents. Parents who are overly involved sometimes are referred to as helicopter parents. They create additional challenges during dental appointments. It's important to set boundaries early on, gently guiding parents about when they should step back and allow their child to take the lead. So open communication is crucial so parents understand what to expect and feel confident in the process. We should also empower the child, allowing them to feel in control of their dental experience. Over time, as trust builds between us, the parent, the child, we can gradually help the parent step back while maintaining a positive, supportive relationship. And then just managing a busy schedule. It all starts with the morning team huddle where we can discuss a game plan for any challenging patients and address any concerns. Dividing and conquering tasks among the team members ensures we stay on top of everything, clear communication, and of course, just taking a deep breath when things get hectic. And then most importantly, we must remember to prioritize the needs of our patients. Every child deserves our full attention and care, no matter how busy the day gets. So happy visits. The purpose of a happy visit is for neurodivergent and medically complex children is to make their time at the dentist feel safe and comfortable. We aim to establish a positive association. So we want children to feel happy and at ease when they visit the dentist by creating a positive experience early on. We help them build a sense of trust that makes future visits much smoother. We assess individual needs at these appointments. So every child is different. So we take time to get to know each child's unique needs, preferences, and sensitivities. And this allows us to adapt our approach and create an environment that works best for them. Promote early dental care. Starting dental visits early helps children become familiar with the process and prevents issues down the road. It's all about making dental care a regular and comfortable part of their routine. And then desensitizing the patient. For many kids, the dentist's office can feel overwhelming. So through the happy visits, we help ease them into the experience, gently introducing them to the sounds, the sights, the sensations of the office so it doesn't feel scary or anxious. And then ultimately our goal is to make each visit a positive experience, helping these kids feel confident and cared for while building a foundation for lifelong oral health. A happy visit at a pediatric dentist can benefit young children, first-time dental patients, children with dental anxiety, children with sensory sensitivities, children with medical complexities, and parents that are just seeking a smooth dental experience. We encourage them to come in about a week before their first visit to tour the office, see what we do. We can walk them through the process. Making the experience extra fun. So this is why I love pediatric dentistry. There are so many ways that we can make a visit enjoyable for the child. So one of my favorites is Zuby gloves. Zuby offers a variety of scented gloves with flavors like grape and bubblegum. Those are especially popular with the children. These are colorful scented gloves and they add an extra layer of fun to the experience. Dr. John's lollipops. These are not only delicious, but also a healthier treat made with xylitol and no artificial dyes. It's a sweet, guilt-free option that supports kids' oral health while also giving them a little something to enjoy after the visit. Small potty, we have one in our patient bathroom, and it is a big hit with the little ones. It's a simple touch that can make kids feel more at home and comfortable in the office, adding a layer of convenience for parents and giving the kids a little independence. A kid-size entrance door can make this experience feel like an adventure. It gives children their own special way to enter the office, making them feel important and excited to be a part of the process. It's like they have their own little secret path. Flavored suction straws, many brands offer them. This one, the Comfort Plus brand, those are bubblegum flavored. They're really good. Having a movie overhead is a fantastic way to distract and entertain the kids during their dental visit. It's a great way to keep them relaxed and entertained while they're laying back in the chair. Plus it gives them something to look forward to. Balloons are always a big hit with the kids. They love picking their favorite color and it's a fun way to end the visit on a high note. Just make sure to tie it to something so it doesn't float away. Kids will appreciate that. Themed rooms, we like, whether it be a fire station, a bake shop, Disney characters, movies, or sports teams, it can just completely transform the environment into something fun and exciting. So these creative themes make the operatory feel more like a playful space than a clinical one, and kids will love the immersive experience. And then kid approved fluoride. One of the most lasting impressions kids have of their dental visit is the fluoride treatment. Whether they love it or hate it, it's something that's always going to stick with them. So making this part of the visit as enjoyable as possible is key to ensuring that they leave with a positive experience. We have a variety of fluoride varnish options to make this process more kid-friendly. I don't know how to say it, but it's Profil, I think. It's a newer unflavored fluoride varnish that's not sticky. This option has been a game changer, especially for kids who are sensitive to texture or taste. Kayla and I recently tried it and absolutely love it. It comes in both mint and unflavored options, but there's no texture. It's a little on the pricier side, in my opinion, but it's the best fluoride option on the market. Wonderful Dental, they have a fun marshmallow flavor that kids really seem to enjoy, perfect for making the experience a little sweeter. Voco Cola Lime. This flavor has been well tolerated by children at my previous office. It offers like a fun twist on the familiar taste of cola. And then Floridose, that's another popular brand that kids love. It's a great choice for making it a little bit more enjoyable. Let's see. For gel options, there's gelato neutral, strawberry, marshmallow, mango, mango. Zuby has quite a few, and then Colors is another brand. We use all of those in our office. We primarily apply foam and gel due to patient compliance. While many children might tell you that fluoride is like their least favorite part of the visit, we try to go above and beyond to accommodate their preferences and create a positive experience. So gel and foam have been well received, and while they aren't as effective as sodium fluoride varnish, they are a great option for our low risk patients. For our children who are considered higher risk, we use the Zuby cupcake varnish, and that seems to be a good option. And to make things more exciting, we have a fluoride mini board that features like a variety of seasonal and fun flavor combinations, s'mores, candy carts, blue Slurpee, red Starburst has been like the biggest hit lately. So yeah.
Okay, let's talk about some OHI. So disclosing solution is a super helpful tool to use in pediatrics. And the best part about it is they can still continue to use it at home if they really like how it worked in the office and like using it as a learning tool, because you can get it on Amazon. You can get anything on Amazon. So I like being able to show the patient like the lighter color of the plaque that the disclosing solution is showing is like plaque that's a little more recent, and then the darker, the more vibrant color is plaque that's been there a really long time. And so if they're literally watching you in the mirror while you're showing them those areas, they can also find it as well. And it's nice for them to discover it, because then they kind of have the like recognition, like, oh, I really do need to be brushing better in the back or the front or wherever they need to step it up a bit. I like to explain plaque to kiddos. Like we have soft sugar bugs. Soft sugar bugs we can easily take care of with our toothbrush and our flossing, but the hard sugar bugs, that's why you come to the dentist. That's what we help you take off, and that's that crunchy stuff. We always get out our crunchy finders, right? And we have to remove all of the crunchies. But I also do like to remind kids that plaque is really sticky. So I had somebody explain it to me one time. It's like having syrup or honey on your teeth. Like if you were to spill syrup or honey on the counter, you can't just like do one swipe and it's gone. You have to go back and spend some time to really make sure all that sticky gooey stuff is gone. So 2 to 3 minutes. That's why we really want that plaque to come off. Oh, I wanted to talk really quick about building a flossing habit. Floss seems to be a barrier not only for kiddos, but also for adults. And so I have been having a little bit more success, I feel like, with my patients when I tell them to make a goal for themselves. Obviously, we want them to floss every day. That's the end goal, but they need to make a goal for them, not for mom, not for dad, but for them. Like if they feel like they can achieve flossing 2 times a week, start with that. That's where I want you to start. And I want you to start flossing 2 times a week until you get really comfortable with it. It's super automatic. You're doing it and being successful time after time, then add another time. I found that when I follow up at the next visit, they're doing better with their flossing. Not always, we still have areas to improve and work on. But I do find that helps take the stress off of them having to leave and having to floss every single day, while still important and stressing the importance of flossing every single day. And also keeping your floss next to your toothbrush. If it's in a cabinet or in a drawer that your toothbrush is nowhere near, you're not getting that visual reminder to pick up the floss. Quick little OHI with patients that have braces. We do recommend brushing 3 times a day because they have all that extra hardware in there. There's extra places for all that plaque to hide and get stuck. There's a few tools that they can use to help in removing all that plaque. We'll demo with the platypus flossers or the super floss for the floss. But I've really been liking the proxy brush a lot lately. We've been having some, no offense to the patients, but some hot mess ortho patients lately. And the proxy brush has just been the winner chicken dinner of our aides. So I just really am excited about showing them that and having them be excited to use it on their own. Water pick is another really good investment, especially if the patient is going to be in braces for a considerable amount of time, or there's a family with multiple siblings in ortho. Great investment. It's going to help get off all of that gooey, fuzzy stuff. I do like to reiterate, though, that the water pick does not replace flossing, and that does disappoint a lot of the kids. But I still praise that they're using it and they're still taking that extra time to remove the most amount of plaque that they possibly can. And then a 3-month recare is also another recommendation we can make to our ortho patients. Typically, insurance doesn't cover it and it's out of pocket. But it's just going to give them that extra benefit of keeping things clean and reducing their risk for cavities because they're already at high risk because they are an ortho. I did have one mom make the patient pay for it, so maybe that's an incentive to be really diligent about their brushing. So those are always all good options. This is another fun little slide about things we do for positive reinforcement. Right now, example is Children's Dental Health Month, and we are giving away a $500 gift card to Great Wolf Lodge, should you all want to enter. No, I'm just kidding. It's just a fun way to get our patients involved with what we're doing and let us know what we are doing right, because they're going to let us know their favorite parts of the dentist. So it's really fun to watch their little entries come through. Another thing I just wanted to touch on super quick is the toothbrushing charts are really popular. I have a lot of families like that option for keeping themselves accountable for making sure that they're brushing 2 times a day. This one right here doesn't show like a flossing column, but there's one that we had that shows floss too. So it's kind of nice. They get to do a sticker checkbox for morning and nighttime brushing, as well as the floss. So that's kind of fun and something we can give out to them. Oh, the tooth fairy. This is my handiwork in the in that upper corner there. I had so much fun bedazzling the tooth fairy's phone. She let me have it for an extended amount of time so I could make sure it was perfect. Anyway, so we have direct line to the tooth fairy, and we tend to call her quite often when we have a patient that has a wiggly tooth, or maybe we need a little extra encouragement to get that wiggly tooth out. We have stickers too for the tooth fairy. It's just a fun little added bonus that we get to use when we're trying to make things fun for kiddos. Little tooth chests are fun to give out as well. That kid that finds out that this is their first wiggly tooth, the look on their face, you guys, is just absolutely priceless. And they are just over the moon about it because they probably already have friends that are losing teeth and they're excited to have their turn. Fun, quick little story. My son lost a tooth. He put it under his pillow, and the tooth fairy left me a note on my little nightstand that she couldn't find the tooth. And but she knew Dr. Sheena was really good friends with the tooth fairy. So I brought the tooth to work. And then, yeah, anyways, long story short, tooth fairy is great. And tooth fairy at grandma and grandpa's house tends to give maybe bigger treats and prizes. So that's a little tip. Let's touch on this next one again, kind of quickly, just because you guys all know about scheduling appointments. The biggest tip I can give you for kiddos when scheduling is when you have two sibs and one is going to be a new patient, but one's been 2, maybe 3 times before. It's preferable to stack those patients. So you'll have the older sib go first and have the younger one watch. Monkey see, monkey do works really, really well with kiddos. And even if they don't watch the whole entire time, they're seeing their bigger sib like relaxed and chill and high-fiving and having fun and all the things and getting to pick a prize. So that's something that typically works really well. This one, I spent maybe just a little bit more time on just because I feel like this is so crucial. Super, super important to let us use our own vocabulary. There's a lot of parents that, God bless their souls, they want to prep their child and just give them so many details about having an op appointment. But honestly, it's like really not recommended to do that. Let us use our terminology. Let us explain how we do things. We've been doing this a while. We've come into like lots of scenarios. So we know the situation we're entering. And they just tend to have better success when they don't know what they're walking into. And especially if the parent is bringing them in like it's any other visit. Just like we're coming in to get our teeth cleaned, it's no different. So that helps that be so successful. So for example, if the patient is due for like an extraction, we're not going to use words like yank or pull or twist or, you know, those are just naughty words. We don't say that. We wiggle, we gently wiggle. That's just, yeah, the preferable terminology. Another example, like the hand pieces. I've had so many parents say, you're going to get your teeth drilled. And I just want to just, yep, I'm giving you the side eye. That's what's happening right now. We don't use the word drill. It's Mr. Bumpy or Mr. Whistle. Words go so far. Some things to help them while they're getting their treatment done is nitrous oxide. This is the little mask that sits on their nose. They get to pick a fun smell to smell or no smell. We do have some patients that don't prefer a smell in there, and that's totally fine. The great thing about nitrous is it just stays in the respiratory system. And then as soon as we switch it back to oxygen for 5 minutes after their appointment, it's cleared out of their system. So always, of course, make sure they're not dizzy and they feel like they have their footing when they get up. But it's a very quick on, quick off type of sedation method or help with their op appointment. I do always kindly remind them that even though their mouth is open to breathe in and out through their nose, because that's a tricky situation. Oral sedation is not something that we do in our office. That would be like an oral medication like Valium or midazolam. So they're awake during those procedures. They're not put to sleep, but they're just very much zoned out. So that's another option for patients who are having just a little bit of trouble with just the nitrous alone. GA is something that we are able to do in our office or at the hospital. And these cases tend to be somebody who has severe anxiety. Maybe we've tried to do it with just the nitrous and it's just not quite cutting the mustard. Or they have like several quadrants of fillings to do or crowns to do. or maybe even pulp therapies. It's better to just kind of get it done all at once, and then we minimize the kind of memory of them having to come in for multiple visits, because kind of by the second or third visit, they catch on what's going to happen. Just quick notes on SDF, silver diamine fluoride. It's amazing. It's awesome. It's a very non-invasive treatment to stop the growth of the caries, and they do have to do their part by flossing at home. It really does help that SDF be more effective. So we do need to have a partnership in that respect, but taking x-rays every 6 months just to make sure we know how that SDF is working, and then if we need to reapply it, then we can reapply it. Again, this is kind of like the fun part of the video's gonna play. They love it and they don't love it at the same time. It's so cute. These tunnels have been just part of our little bread and butter we've added, and they are just so exciting. And if we find out more about the patient specifically during like the treatment, we'll be playing their favorite song super loud too. Not like so loud that it disturbs other people, but you know, we had a Swiftie in the other day. She just loved having that Taylor song on while she was going through the tunnel. It was really cute. Making a super big deal about these things. Like, this is hard for kiddos. It's not easy for adults either. I would love to have confetti thrown at me after I'm done with my treatment. Prizes go a really long ways. They do get double the prizes after they do their op treatment. Positive affirmations throughout the treatment also, as well as after. Sometimes a treasure box prize is in order. We typically will offer that after they've completed all 4 quads of treatment. Or if we've had somebody who just really had a tricky time and they finally have done it, maybe they had a few failed attempts and now they did it. That's big, that's huge. And it shows a lot of growth, and that should be rewarded. So a tunnel, a crown, we have medals, sugar-free suckers, like Lisa was saying, are great things. And then typically we'll send them a good job letter after the fact as well, and you know, make it super colorful and add some stickers to give them that lasting memory that they want to come back and see us.
Right. We are almost at the end, you guys. This is one of my favorite parts of working with kids, is working with those that are neurodivergent or medically complex, because I love a challenge and I love turning a scary experience into a positive one. So just creating inclusive care for all these kiddos. These children have unique needs, and ensuring that your practice is equipped to handle them can make a huge difference for the child's experience. So sensory friendly adaptations such as dimming lights, reducing noise, or offering noise canceling headphones can make a world of difference in helping these kids feel more comfortable and secure. Collaborating with their therapists and their specialists and pediatricians is crucial for understanding each child's specific medical and developmental needs. Inclusive care is all about is about more than just accessibility. It's about respecting and acknowledging each child's individuality and providing personalized care that meets their physical, emotional, and developmental needs. Creating a welcoming, respectful environment that fosters trust and comfort. Communicating effectively with neurodivergent and medically complex children. I prefer this term rather than special needs. There's a lot of controversy around that, so I prefer to go the long route, neurodivergent and medically complex. It requires special patience and understanding. So this might mean using visual aids, clear and simple language, or nonverbal cues. For some children, dental visits may pose challenges such as difficulty sitting still, sensory overload, or anxiety. Remember, parents are the experts on their child. By working closely with them and listening to their insights, we can better understand how to adjust our approach and make the visit as smooth and comfortable as possible. Parents can provide vital information about triggers, coping strategies, and any accommodations that will be helpful for their child And each child is different. Some may require extra time, acquire space, or certain positioning for comfort. Understanding and respecting these varied needs is key to providing the best care. And from the moment the families walk in, just creating a welcoming, inclusive atmosphere can set the tone for a positive experience. A good experience at the dentist can have a lasting positive impact, not just on the child's dental health, but on their overall perception of healthcare. And then wheelchair access and adaptive tools, just ensuring that your office is fully accessible, including wheelchair access and adaptive tools. It's essential for accommodating children with mobility needs or other physical challenges. At the end of the day, inclusive care is about making each child feel seen, heard, and cared for in ways that works for them. And by offering a supportive and understanding environment, you're not only improving the child's dental experience, but also just making a positive difference in the whole family's healthcare journey. So challenges in dental care. When caring for these kiddos, we often encounter just unique challenges. Each child brings their own set of needs and experiences, and it's our job to make sure that they feel comfortable and safe. So sensory sensitivities, many kids, especially those with autism or sensory, can be really sensitive to things like bright lights, loud noises, or even feeling the feeling of dental tools in their mouth. So a simple sound or sensation that seems normal to us can be very overwhelming for them. To help, we can make adjustments like dimming the lights or offering noise canceling headphones or using gentler tools. We recently got cordless polishers, which have made such a huge difference. The kids tolerate them so much better. The kids with anxiety, it's completely normal for them to feel anxious about visiting the dentist, especially if they've had a negative experience in the past. So for these kids, they might express it through like nervousness or fidgeting or even like refusing to cooperate. We always want to be patient and reassuring, take time to explain things in a way that feels less intimidating to them. Offering choices like picking a toothpaste flavor or a favorite TV show to watch just helps them feel in control and more at ease. Communication difficulties. Some kids may have trouble communicating how they're feeling, especially those with conditions like autism or CP. This can be tricky for us to know when they're in pain or if they're feeling overwhelmed. That's why we pay close attention to their body language and nonverbal cues they give us. Children with physical disabilities like CP or muscular dystrophy may face challenges with sitting still or getting in the right position for a dental exam. We always want to try and be mindful of their comfort and use adaptive tools or special equipment when needed. And understanding varied needs, autism, ADHD, CP, Down syndrome, congenital heart defects, diabetes, epilepsy, all of these. Like kids with ADHD, they may benefit from consistent and predictable routines. So providing a visual schedule of the appointment can help them know what to expect and reduce restlessness. And offering them praise and small rewards for cooperation can motivate them to engage positively during their visit. Let's see. So preparing the office environment, creating the right environment is crucial to ensuring the child feels comfortable and at ease during their visit. So one of the things we can do is focus on the physical space, using calming colors in the decor, such as soft blues or greens. They can have a soothing effect on kids. They promote relaxation and reduce stress. Also soft lighting, minimal distractions, giving them a private room. It's also essential that the room is free from like loud noises or screaming children, which is kind of hard in pediatrics, but that's why we do have 2 quiet rooms in our office, which are super helpful for these kiddos. Allowing time for the child to acclimate. It's important to give them time to adjust to the new environment, and then creating that welcoming atmosphere. Let's see, sensory friendly adaptations, offering noise canceling headphones, fidget toys, extra dark sunglasses, a cup of water to swish and spit in, weighted blankets, cordless polishers. And then wheelchair and access and adaptive tools. It's essential for making every child feel comfortable. Make sure your office is wheelchair accessible. And yeah. So effective communication is essential in pediatric dentistry, especially when working with children who have diverse needs. So effective communication, it's simple, it's direct. Using clear and straightforward language helps children understand instructions and reduces anxiety. So for example, instead of saying, let's get ready for your cleaning, you might say, it's time to brush your teeth now, or incorporate visual aids. Utilizing tools like picture cards or visual schedules can assist the child in comprehending the procedure and what to expect. Brush teeth and then you get a prize. So first we brush your teeth, then you can choose a sticker. Helps children understand the structure of the visit and what to anticipate. Counting, we will brush each side of your mouth for 5 seconds, giving them a time frame. Collaborating with parents, learn about the child's preferences, understanding their likes, dislikes, and comfort zones, identifying any triggers. I had a kiddo that was terrified of clapping, so knowing that ahead of time was really helpful because we tend to clap and give a lot of praise. And then just asking them, what can we do to make your child feel more comfortable in our office? And then behavioral challenges, use positive reinforcement, recognizing and rewarding desired behaviors, create predictable routines. So establishing a consistent routine helps children know what to expect. Remain patient, just demonstrating patience and understanding allows children to feel safe and supported, and go with the flow. What's next? Oh, I did want to add one more thing. So I recently came across, okay, we're almost out of time, but just something I want to touch on. When a nonverbal child is expressing signs of discomfort, saying it's okay, it can be dismissive of their feelings. And I'm personally trying to be more conscious of that. Like, it's okay. It's okay. Nonverbal children often have limited ways of expressing their discomfort or fear. So simply saying it's okay can invalidate their experience and make them feel misunderstood or ignored. They need reassurance that their feelings are being acknowledged. So instead of offering empty comfort, it's crucial to show empathy by acknowledging their distress and responding with care, like phrases like, I see you're feeling upset, let's take a break. And then saying it's okay can inadvertently shut down things further for communication and opportunities to meet the child's emotional needs. So children rely on us to be their advocates, especially when they can't vocalize their needs. So when we say it's okay without addressing the underlying discomfort, it may foster confusion or mistrust. So making it harder for the child to feel safe and secure. So just be very conscious of our words and respect these children. Yay. Does anybody have questions?
I don't know.
Is anyone there?
I don't know.
We're here. You guys did an excellent job. This was such a great presentation. It was so colorful and so much information. I mean, you did have a lot of information in there, and I think that's excellent. So thank you so much. Is there any questions from anyone? There's 30 people out here, so there just might be a question. I don't see any yet. Nope. I mean, you gave us so much to think about. Is there one? Oh, here's
There
one.
is one.
Oh,
yeah.
yay.
What is your office's policy on the use of lead aprons in pediatrics?
We use them. The thyroid gland is what's protected by that thyroid collar, and that is a critical gland for development of kids. So exposure to radiation at a young age is not a good thing. So we absolutely use a thyroid collar. And actually, even on our older patients, we just automatically put the jacket on them. I do sometimes joke with parents. I'm like, well, you don't have to wear this at your office if you don't want to. And then they look at me like I have holes in my head. So I think it's still pretty common practice for people to wear a lead apron while they're taking x-rays. I mean, at least in my experience.
Yeah.
Thank you.
Here's another one. How many times do you try before you decide not to do a procedure?
An operative, I'm assuming you're saying like an operative procedure. I feel like that's kind of up to the doctors. I feel like I've seen a couple of no-goes before we start talking about doing a sedation method. And again, it depends on how much treatment they have. If they have like 2 fillings, we're obviously not going to push to put them under for 2 fillings. We're going to try to place SDF and see if we can buy a little bit more time for them until maybe they're another year older. And then at that time, maybe they're ready to do the treatment with just nitrous and they'll be successful at it. So it really depends on the treatment plan and the situation. Sorry if I didn't answer that
Yeah, and
question
I feel like
properly.
we're kind of resorting to silver diamine more now too for those kiddos that can't cooperate for treatment cases. And it really does help us buy time basically with these kids and allow them to get more comfortable in the setting and make sure we're making a positive experience for them. That's what it really comes down to at the end of the day.
Somebody else asked, is it okay to make eye contact with neurodivergent patients?
It is. Yeah.
Yeah.
It feels like a connection to them, you know, and personable.
Well, I think you guys did a great job. I see that there is Dr. Sheen is on there telling you nice job. She did come. Did you want to say anything, Dr. Cancel? Did you want to say anything? Is she gonna hide?
She's gonna
No,
hide.
no, no, no. I'm here. I'm here. I
Okay.
just had to press
Okay.
the unmute button. I mean, yeah, I work with these wonderful hygienists, and even though I see them 3 times a week, I learned a lot from this as well. So thank you to both of you. So
Yeah, we really appreciate it for sure. And thank you to Dr. Cancel for encouraging them to come and do this for us. We really do appreciate it.
And for being the best boss ever. I mean,
Yep.
let's not lie.
oh, Dr. Bramley and I love working with you. So thank you, thank you, thank you.
All right. Well, thanks everyone for joining us this evening. And we look forward to more continuing education courses that ODAA will provide, and have a great rest of your evening. Thank you, Lisa and Kayla, so much. We really appreciate it.
Thank you.
Uh-huh. Good night.
Stop sharing. Oh, stop share. It's still there.